friends, welcome to my channel. Today we're going to do a USMLE STEP overview of all the different steps that you need to take in order to apply for residency in the United States. First of all, USMLE. What does it mean? It means United States Medical Licensing Examination. And this is a series of tests that all the medical students in the United States and outside of the United States need to take in order to be eligible to apply for a residency spot in the United States. So we're going to start with step 1. Step 1 is a test that is going to ask you questions about the basic sciences, and this consists of 280 questions in total. You get 7 40-question blocks, and you get 1 hour to do each block. And you do get a 45-minute break and also a 15-minute tutorial, which is optional. So if you decide not to do the tutorial because you have done it before, you get an extra 15 minutes of break. So in total, you can have up to 1 hour break. And you can take this break in whichever way you want it, like 10 minutes after one block or after 2 blocks, whichever you may want. And it's a test of general principles, which are biochemistry, immunology, microbiology, pathology, pharmacology, and public health sciences. And it's also testing you on organ systems, which include cardiovascular, endocrine, gastrointestinal, hematology, oncology, musculoskeletal, skin and connective tissue, neurology and special senses, psychiatry, renal, reproductive, and respiratory. After step 1, we go on to step 2, and step 2 is divided into 2 different tests. The first one is called clinical knowledge, which is also a computer-based test. And this is going to assess your ability to apply medical knowledge and clinical knowledge. So you have also 8 blocks, which are each one 1 hour long. And on the website, it says that each block will vary on the items or the number of questions that you get, but it will not exceed 40 questions per block. And also the total questions in the exam will not be over 318. So the way I see it, so just my mind will keep it straight, is also you get about 40 questions per block, and if you're doing 8 blocks, you get like around 320 questions. But it says on the website, which I'll post the links down in the description below, that you would not get over 318 questions. This test is 9 hours long because you get 8 blocks that are 1 hour each, and you also have a 45-minute break. And this is mainly focusing on internal medicine, obstetrics and gynecology, pediatrics, preventive medicine, psychiatry, and surgery. Okay, and now we move on to step 2, CS, which is the clinical skills portion of this test, which due to COVID pandemic, it has been suspended. Right now, they're doing different pathways, but this test may be reinstated next year in 2022. So it consists of 12 patients, which are actually actors, but it's going to test your clinical skills, clinical judgment, and how you apply it to patient care. You get 15 minutes per patient, and you have to perform a focused physical examination. And you have to arrive at preliminary differential diagnosis, and you also have 10 minutes to write a note. You have to treat each patient as if it is a real one. You have to do the examination. In this test, you do get a 10-minute break after seeing patients number 3 and number 9, and a 30-minute lunch break after seeing patient number 6. Right now, this step has been canceled, so they're doing 6 different pathways that you could take in order to fulfill this step. Most of the people have to do an OET, which is an occupational English test. It's pretty much like an English exam. And after that, we go on to step 3, which this is the final step that you have to take, or the final test. But this test is a 2-day test. It's going to assess whether you can apply medical knowledge and understanding of science when you're not being supervised. And it puts a lot of emphasis on patient management and in ambulatory settings. On the first day, you're going to go over the foundations of independent practice. In here, it is a computer-based test. You have to focus on assessment of knowledge and basic medical and scientific principles. This is a multiple choice question, just like all the other computer-based question tests. It consists of 232 questions, which are divided into 6 blocks, which have 38 to 39 questions each. You do get 60 minutes per block and a 45-minute break with a 5-minute tutorial. And here, pretty much, you just have to know like all diagnosis, management, history, physical examination, everything that you need to do in order to diagnose a patient. And that's the first day. Day 2 It focuses on advanced clinical medicine. This is a 9-hour-long exam, and it consists of 180 multiple choice questions, and you get 45 minutes per block. After this, you do get 13 computer-based simulations, and you have to do each one in 10 or 20 minutes. And after that, you get a 45-minute break in this test. The test mainly is focusing on your ability to apply comprehensive knowledge of health and disease in the context of patient management. So like I mentioned, this is also a computer-based test, but it's 2 days long. And this is the final test that you need to take in order to complete all of your STEPs examinations. This is the last test, but most people that apply to residency in the United States do not take it before applying to residency. You can apply to residency by just taking the first and the second steps. And this third final step is mostly done on your first year of residency. But if you're like an international medical graduate, like I am, it is recommended that you do take it before you apply to residency. This just allows like people in the hospitals and to see that you're really committed to doing residency. You're already taking the third step, and you're not going to be worrying about having to study for it in your first year of residency, and you can use that time instead to focus on actually learning for your residency program. So a lot of people take it beforehand, international medical graduates, I mean, and many people don't. So it is up to you. At this moment, I don't know yet when I'm going to take it, but I will let you know later on. That's pretty much for this video. I hope you like it. This was a quick overview of what USMLE STEP examinations are like, and I'm hoping later on to continue this series and maybe do like a timeline.